Hello, I'm Dr. Douglas Bull. I'm an ophthalmologist here at Reedsburg Area Medical Center. Today I'd like to talk to you about macular degeneration. Macular degeneration is a very common problem that affects millions of people worldwide. The problem of macular degeneration affects about 1 in 3 individuals over 75. So it's a very common problem that we see in our office every day. Macular degeneration affects the central part of your retina, the macula. There are deposits that develop in the dry type of macular degeneration that affect the overlying retinal cells that provide vision. As a consequence, people develop symptoms such as blurred central vision, difficulty with colors, difficulty recognizing faces. Macular degeneration is somewhat opposite to glaucoma, where the peripheral vision is affected in glaucoma. The central vision is most commonly affected in macular degeneration. So it can be more devastating and also in a quicker fashion. So regular appointments to evaluate for this, especially over the age of 60 to 65, is very important. To diagnose macular degeneration, an ophthalmologist such as myself will perform both an exam at the slit lamp, which is a microscope that examines the front part of your eye, but also a dilated exam, which allows us to see through your pupil to the back of your eye. Physical exam can oftentimes diagnose this problem by what we see physically in your retina, but also we can use other adjunctive tests such as an optical coherence tomography, which is a test that uses a scan to give us a cross-sectional analysis of your macula. The ability to diagnose this condition in an early phase is essential to helping to prevent further damage from macular degeneration. The problem with macular degeneration is that it has very limited treatment options. It's a potentially progressive disease that can continue over the course of your life. However, not everyone has complete vision loss or severe vision loss. There is a very significant spectrum to the disease for most people. However, continued close monitoring is essential in order to pick up on things early enough, such as new blood vessel growth, which is what the wet type of macular degeneration is. So there are 2 types of macular degeneration that most of your doctors will talk to you about, and that is the dry type and the wet type. And dry just means that there's no bleeding. And this is approximately 85 to 90% of patients with macular degeneration. The wet type is about 10% of people for the most part. That's where new blood vessels grow through the degenerated areas and then can cause even more extensive damage to the overlying retinal cells and then cause a more rapid vision loss. So detecting this at an early stage is essential to preserving your vision.